Acupuncture is a complex branch of ancient Chinese medicine, but its practical principles and methods are easily understood. 14 major energy channels called meridians course through the human body, including the head, arms, hands, legs, feet, torso, and internal organs. A subtle energy called qi circulates via the meridians to all the parts of the body, even the most remote cells. Qi is the vital force, the presence of which separates the living from the dead. Its balanced, unimpeded flow is critical to sound health. Any misdirection, blockage, or other derangement of the amount, flow, or balance of qi may result in pain, dysfunction, and ill health. With acupuncture needles or other means, the acupuncturist stimulates certain points, acupoints, along the course of the meridians. Such stimulation helps restore the normal balance and flow of qi, so organs and bodily systems can work together in harmony as intended. This sets the stage for the body to repair itself and maintain its own health. The first thing the acupuncturist will do is get a little bit of information from the patient about why she's there and describe what she's going to be doing in the session.
Just let yourself relax.
She first checks the pulses, and this gives her information about how the energy is flowing through the body. So she'll spend a good amount of time feeling to see if the energy is too high, too low, and that's going to help guide her treatment. And of course she does it on both sides to see if the two sides of the body are balanced.
Okay, could you just
now she's looking at her tongue. By looking at the color of the tongue and the quality of the tongue, that's going to give the acupuncturist information about the internal organs. And then she will also usually palpate different areas on the abdomen. And this is another way to check for energy blockages in the central channels. So overall, the beginning of the session is to just assess how the energy flow is and how the vital organs are. The body will actually tell her what treatment is needed. So she's having her turn over because she's going to put the needles into the back. The needles that she uses are sterile needles. They're single use only. They're all disposable. They're very, very small needles. She's going to swab the areas of the back where the needles are going to go with alcohol to make sure that everything is clean. She is explaining to the patient what she's going to be doing. Now what she's doing is counting vertebrae and feeling to find the exact spot where the points are, and she just taps the needle in. The acupuncture points are actually low voltage entry points. These have been measured, and the voltage is about 20 points lower where the acupoints are. So the needles are practically sucked in through the skin, and what that does is they go right into the energy channels in the body, into the meridians. So they have to be very precise about where the needles go in. If they're not in the right spot, they won't be entering into the energy pathways. Now what she will usually do before addressing a specific symptom is to first balance the entire energy system.
The meridians in the deep well in the body, what's called the yin energy.
And when she puts the needles in, if there's an area in the energy system and in the body where there's too much energy, an erythema or a redness will develop around the needle. It's like a pressure valve. So she leaves the needles in until all of the redness goes away, and then she knows that the energy has been balanced and unblocked. And you can see the patient is very comfortable. The needles, for the most part, are painless. There are some points that are tender, but usually the back is very painless, and it's actually a very relaxing treatment. And she's communicating with the patient as she's treating her to see how she's doing and how she's feeling, telling her what she's doing. There you can see the individually packaged needles, sterile, disposable, and just how very small the tip of the needle is. This treatment has been around for about 5,000 years. It was started by the Chinese. Now you can see she's checking the pulses again to see how the treatment is doing. She can feel a change in the pulses depending on how the energy is changing. So she has some feedback as to how the treatment is doing and how the patient is doing. And she can feel when the energy balances and corrects itself. And again, she always checks on both sides. So literally what happens as the energy channels get unblocked is the energy that flows to the organs and the different parts of the body gets freed up. And that restores health and it restores vitality. And in the process of that, symptoms will resolve. So she's checking the pulses. She's also looking to see if the redness around the needles has resolved. And that gives her an indication of when the treatment is finished and when to remove the needles. She may have found by checking the points and the pulses that there's some tension or blockages in the neck area. And you can see the client feels very relaxed. She's doing some energy balancing by putting her hand at the base of the spine. And she'll just let her lie there and leave the needles in while they continue to work to clear the energy. Okay, so she's checking in to see how she feels. At this point, the treatment is finished.
How are you doing? Great. Good. I'm going to take the needles out.
So she'll remove the needles, and they'll be disposed of. And then she'll give the patient some instructions as to what to expect and how she might feel after the treatment. She'll instruct her to drink a lot of water because it is a detoxification process.
That's great.
And now she's just going to let her rest for a few minutes before she gets up.
You look nice and bright.
Once again, checking the pulses to see how the treatment worked.
So when you come back for your follow-up,
Instructing her for what to do the rest of the day, how to do some deep relaxing breathing, probably telling her not to exert herself or do anything strenuous for the rest of the day.
Questions?
The second treatment, what you do?
Just asking her how the treatment went and how she felt.
It all goes in your back, or how does that?
No, not at all. The second treatment, what we do is
Explaining to her what she found and what other treatments might be necessary.
we're listening to your flow of energy, and it's telling us what you need.